Welcome to Special Care Short Clips and Tips with your Special Smiles. Today, Savannah is going to talk to you about avoiding aspiration when cleaning teeth. Aspiration is when something gets into the lung that is not supposed to be there. Food debris, gastric secretions, oral secretions are some examples. This can cause problems in the lung, such as inflammation or infection.
In patients with a high risk of aspiration, it's best to keep them upright or semi-upright. So prior to starting any brushing or any treatment, if you can adjust their positioning, that would minimize their risk.
This illustration shows how an upright or even slightly leaning forward position can decrease aspiration risk when performing oral care.
Another thing to consider in patients with a high risk of aspiration is to control the amount of water that is used, whether that's in a cup or a water pick or anything else. And so something that I found that helps with the water pick is to keep your finger on the power button and keep turning it on and off to minimize the amount of water that is in the mouth at all times.
To assess oral care aspiration risk, do they have impaired swallowing? Do they need their liquids thickened? Do they use a feeding tube? Do they have GERD or frequent vomiting? And do they have a history of aspiration? If the answer to any of those are yes, they're probably at higher risk for aspiration. Thank you for taking the time to learn about aspiration. Special Care Short Clips and Tips is a series of short videos produced by Your Special Smiles to help dental care professionals feel more comfortable treating patients who have complex medical histories or disabilities. We hope you enjoyed this presentation and we look forward to producing more. Special thank you to Ms. Savannah Hendren, our regular oral hygiene provider and soon to be RDH.